My name is Kulbida. I'm one of the OB hospitalists here at Bellevue Women's Care Center at Ellis Medicine, and I'm also the medical director at this facility, in addition to being the chairman of the OBGYN department. The thing that I like the best about what I do is I love to help people in that particular time of need. For one, it's usually a happy time for most. And it's nice when you can help them out under those circumstances, especially when they're somewhat scared, not sure exactly what's happening, and the idea is to really try to get them through this, to be that voice of reason and calming, and to basically do all the right things, so it's nice. It's nice to feel wanted, it's nice to feel like you're doing the right thing, and I think that's the major reason why I keep doing it. I started in Connecticut, and we lived in Connecticut for about 5 years. And then my wife actually got a job here, and at that particular time I had my own practice, so it was a big decision for us in order to come out here. But I think one of the things that made it so wonderful when we did come out here is that I found this place. And I suppose now that I look back at the 10 years that we have been in the area, I don't see myself having practiced anywhere else. The unique thing about this site over the years is that it's been dedicated to women's care. And you don't find too many places like that. And I think just from that alone, I fell in love with it, the fact that they were so dedicated to what they were doing. And I became a part of it, and I've loved it every minute. One of the things that we started was this OB hospitalist program, where we actually have a physician on site here 24 hours, 7 days a week. In obstetrics, you never know when something dramatic is going to happen on an emergency level, and you want somebody here who can handle it in a moment's notice. So I think we've kind of given a lot of reassurance to the community, to our patients, and to the physicians who practice in this facility that somebody's always here to help them out. Now that we've got somebody here, we basically step in at a moment's notice and do what we need to do in order to get that person through whatever emergency they have at the time. So I think that's been a major asset. So basically the doctors are running between their offices and the hospital, trying to make both ends meet. Sometimes that's very difficult, and like I said, you never know when things are going to potentially change on the labor and delivery unit. And if they need us, we're here. So if there's an emergency, we're ready to step in and help them out until they can come in, or even after they come in, if they need additional hands, we can provide that. Only the patients can tell us if we're succeeding. Since we seem to have more patients, I'm hoping that we are.